know, somebody that's sort of behind the scenes in the College of Pharmacy. In my perspective, a legend. I mean, really somebody very extraordinary that is actually going to do the introduction today. And that's Dr. Johnny Lewis. And Dr. Lewis is the person, she's done so much for the program, but she's kind of behind the scenes. Supposedly she's retired. I have no evidence that that's actually true.
Nor does she.
Nor does she. But yeah, I mean, this is somebody that all the students need to know. And you know, the graduate students, most of you are here, and that's great. You're going to get to meet Dr. Lewis. But I wish the undergraduates, and we have a few of those in the audience as well, so that's great. And I wish the PharmD students got to know her, so maybe we have some PharmD students, and let's get the good word around. Anyway, I'm going to have you welcome Dr. Lewis to give the introduction to our very special guest today that she's going to introduce if I should ever give her the chance to do so. Dr. Lewis.
Well, thank you, Todd. Can you hear me in the back?
I'll stand next to you
Okay.
so you can.
No, that's okay. I'll scream.
Okay.
So thank you for that. I promised Katrina I'm going to do a very brief introduction so she actually has time to tell you all the wonderful stuff she's planned for. I've known Katrina for more than 25 years, and we were part of a small group of people who ran CECs with P30 centers back at that point when they were just kind of developing this whole concept of community driving research and partnered research with communities and the responsibility of science to know and investigate the issues of communities in order to inform policies that reduce risk. And for 30 years, we've all maintained that, and I think we've seen the field change dramatically. So Katrina is one of the pioneers there and has written a wonderful book on that whole topic with some great case studies that you should all also look at. But one other thing I want to highlight in her career is she is now also a director for a
Center for Oceans and Human Health. Yep.
On microplastics. So that is another point now of intersection that comes in much later in our career. So I'm going to turn things over to Katrina and hope that you all have a little bit of chance to ask her a lot of questions in the end as a result.
Okay. Thank you so much. Yes. Thanks to Johnny for introducing me briefly and graciously and outing me as being a really old person, as you can't tell. And I wanted to start by giving you just a little bit of overview of how I come to this work. And first I need to know how many of you are passionate about microplastics? Yeah, a lot of you. I'm not talking about microplastics, so you can leave now if you want to, but I'm trying really, really hard to tailor what I do have to say in ways that will be relevant to hopefully all of you, whether or not you care about microplastics or housing or any of the other things I'm going to talk about. So Tamara, thank you so much for inviting me to come as part of, we are sister centers, and she's my opposite there, so I'm the CEC director at the P30 Center in Rochester, as Johnny said, and that's how we met, although those many years ago. And Tamara said she thought it would be interesting for you, because you all work on different things, to think about the issues involved with reporting back research results to participants, whatever the field those may be in. So I'm going to try to do that today, but wrapped in a sandwich of other stuff that I hope will be of interest to you otherwise. I'm a policy scientist. I went to the Nicholas School of the Environment at Duke because when I was going to graduate school and I knew I wanted interdisciplinary training, that was one of the few places you could do that. And I know that you are getting a lot of interdisciplinary training here now, and that is partly because of places that pioneered interdisciplinary training, particularly in ecosystem management and conservation areas, and realizing that that was essential to being able to solve problems. So I'm really happy that you have that opportunity here. My passion was always about how science gets used in decision-making processes that engage engage communities. So although I was trained at a marine lab working on coastal ecosystem management with fishing and farming communities and others, those skills and those interests readily translate into the field of environmental health in some ways I hope I'll be able to share with you today. So when I landed in Rochester, which notably does not have a coast. Okay, it does. Teddy, don't out me to Carl for saying that. My husband tried to persuade me that because we have a fifth coast on the Great Lakes, that counts. I answered that it's freshwater, doesn't smell right, doesn't count. But nonetheless, we didn't have the same kinds of issues that I had been trained to work on, watershed protection, farmland preservation. We're just not as salient there. What people were really worried about was lead poisoning. And I was really not interested in lead poisoning because this was 2000. We had solved this problem long ago. I went to college in Providence, Rhode Island, where literally as undergraduates, we had solved the problem of lead there, not solved, but certainly made a huge difference. So I really did not want to work on lead in Rochester, but it was clear that that kids there had 20 times the national rate of lead poisoning. So lead as a biomedical problem is the same everywhere, but in terms of policy solutions, it's different everywhere. So as a policy scientist, I became very involved in working in housing, old housing stock in really poor condition, because Rochester is the third poorest city of its size in the country. And as a result, we had a lot of lead poisoning. So it turned out that our university had one of these core centers, like you do, that is charged with linking research and community. Since that was the community interest, and we'd done lots of research on lead, that was a nice fit. I've worked there ever since. So the initial focus of my work in community engagement was for my partnership as a member of the Coalition to Prevent Lead Poisoning. And since then, we've worked on a lot of other issues, expanding to healthy housing, air quality, vaping, fracking, and now microplastics. But all the common theme running through all that work has been working with coalitions of diverse stakeholders to engage in policy and systems change. And our contribution to that has been analysis, education, evaluation, and linking up local efforts with this national network. So as a policy scientist, we always start when we're talking about things and writing papers with expressing the standpoint. The standpoint is really important to know who is sharing information with you and what is their orientation to that. So I am a participant observer. In other words, I was involved in healthy housing work, but also observing it and doing research on it with a problem orientation on wanting to address that problem. And as Johnny said, yes, I wrote this book, which was inspired by Johnny and two of our other friends who went to a P30 meeting, one of my first ones, and started talking about how in our very different geographies and cultural and political settings, we all saw policy being influenced by science, but it didn't happen by magic. There were people like us, social scientists, multidisciplinary trained people who were engaging with communities who were paid to develop partnerships and to do the work of bringing people together to help bring science into making a difference. And we realized that those messages and those lessons aren't shared through disciplinary journals or societies or presentations, and sort of hypothesized, we should write a book together. And it turns out they got busy doing more important things, and I was left to write the book, which I am shamelessly advertising because it is available for free. And the case studies that it includes are lead poisoning prevention in Rochester, New York, air quality around Los Angeles, and built environment in Duluth, Minnesota. Right, so happy to talk more about these themes anytime, but I hope they resonate with you and the great work that you do here with communities. Our focus in this book was urban, because I recognize that some of these dynamics and the ways groups work together are really different in a rural setting, but would love to talk more about to what extent that applies and doesn't. Okay, so I'm talking about report back, but as I said before, I think understanding someone's standpoint and how they come to an issue is really important to understand their perspective. So I'm going to start really small with my story, get really big about this field, get small again on this case study that Tamara asked me to share with you, and then big on how we want to move this together and hopefully co-opt your help in doing so and leave time to chat about it. So as I described, I've been involved in environmental health community engagement for about 25 years, always with this systems change problem orientation. And I remember about 15 years ago, they were trying to start the National Children's Study, 10 years ago, and people who wanted to roll that out in Rochester as a site, coming to our engagement core and saying, hey, can you start softening the ground and let people know this study's gonna happen, and when they get the letter, they should sign up? And I'm like, okay, so what? What's in it for them? And they're like, because we're going to learn all these great things about kids' health, and it's going to be national, and it's representative, it's going to be really awesome. Like, and what's it for them? And they're like, well, I finally figured out they did not intend to give any results back to the participants. They didn't even intend to allow local researchers to share the local results, and never mind drive what the research questions were. So I was like, how could I possibly leverage my relationships with community to recruit into this study that they will get nothing from? And that made me mad, and it sort of set me off thinking about this engagement work we do. That report back process is really the foundation for that engagement, and took me a while to figure out why that made me so mad. A couple of years later, we had a researcher who was studying air quality and recruited from faculty to participate, and I was like, well, if you want me to recruit my community partners, what are they going to get out of it? Are you going to report back? And he said, yes, absolutely. I said, okay, if people are interested in their air quality, I'll let them know that. So I also participated. I got the result back. And my husband and I literally both have PhDs in environmental science, and we could not understand the results. So that was another aha moment. This is really important. It's foundational, and you need to do it well. So I started listening to our colleagues across the country who are involved in community engagement cores and other areas of environmental public health about trying to figure out how to do this well. I was like, oh, now I get it. Now I think I understand why this is so important to them. And usually when I'm trying to learn something new, I realize at a certain point I need to do it to make lots of mistakes and learn more about it. So I'm going to tell you very briefly how I had a little experience there digging into this Rock Home project, and then take a step back to being like, I've drunk the Kool-Aid. I get this is really important. It's also way more complicated than just pulling a lever and saying we should do this. How can we institutionalize this as a practice? How can we all do a better job of it? So first I need to clarify what I mean by report back, because there's a lot of different ways that those two very common sense words get used. In this case, I mean individual report back of individual level results. And first, community first. So usually you think, the scientists, you've probably been trained, you do your work, right? You embargo it, you keep it close, you publish it, and then you translate it, right? This is exactly the opposite. That we shouldn't be sharing information about people until they've heard it first. This is not news to you because you're being trained in a proper way. But this is pretty radical from the way most people do business in other parts of the country. But it's also important when you're doing that to use language and tools and approaches that are appropriate for whatever that population that's been participating is. And that recognizing that the results that are meaningful to people who are in the study may be different than the questions you're investigating as a researcher. And that makes this process also really complicated for researchers who are trained and focused on answering a particular question. This individual report back is almost always nested within report back at the community level. And I do think a lot of the things that we learn from thinking really carefully about individual report back are relevant to community level report back. But when I say report back, I mean individual report back of individual results. The practice of doing so has expanded rapidly over the last 25 years, started from a sort of similar aha moment when the Brown IRB refused to let the Silent Spring Institute report back results to a cohort of breast cancer survivors who had inspired and asked for this study and figured out the money to pay for it. And that made them mad, and they started studying, why can't we? What impact does it have on participants when we share? What does come of it? As a scientific practice, as a practice of social science. And over the past 25 years, this whole field, I call it a field of practice of report back, has grown up. And Silent Spring has been one of the leaders in this. So you notice that I listed them on my first slide, very much partners in this work. Many of these slides have been provided by them. And they have studied what happens when you do report back to individuals and interview them afterwards, and learned about how, not only how to do report back, but what effect does that have on people? What actions do they take take? Does it just worry them? And what happens next? This has been pretty successful, so increasingly there's sort of a sense out there that we should be doing this, but there aren't clear guidelines about how or why. And it's mostly evolved in the field of community engaged research, which makes sense, right? Because of that, like that first example I gave you, where a community of breast cancer survivors wanted this study done, it was done. Clearly, they want their results back. So that kind of community context has been the basis of most of this research, but doesn't mean that's the only place that report back should happen. So I wanted to point out that Silent Spring Institute did a bibliography of the literature in this field that's now almost 2 years old, and as of then, there were over 40 articles that talked directly about the process of report back, many of which were done by people in other places. So I don't want to say that it's monolithic, this is Silent Spring's field. They have been a pioneer and a leader, and also functioning to pull together people who are interested in learning about how can we leverage the impact of our research by doing the report back and doing it well. And they found that there are many reasons that one would want to do report back, and these are some of the things that they highlight. And one of the things that I think is underestimated is how it improves science. So when people come to report back, something like, oh, it takes so much money, it's so hard. Of course we want to give back to the community, but not recognizing that there are many, many documented examples of how it enhances the research. Again, not news to anybody in this room, but an important thing to emphasize with messaging. One of the things that Silent Spring has done is to listen to researchers about how logistically complicated and challenging it would be if you imagine you have a study with 200 participants and you need an individualized report for each one of them. Doing that by hand is really a lot of work. So they've developed a digital software that automates that process and populates them. It's called Derby. I'm going to refer to it later, so I just wanted to explain to you the origin story of Derby and how it has been adapted for many different contexts, including smartphones. They also made a handbook for report back that's now kind of dated, and I'll explain to you how we're trying to build on that. But if you are interested in diving into this right now, this is the best resource out there. This work also helped contribute to a NASM consensus study in 2018 that concluded that report back is generally underpracticed, and it's a matter of reciprocity, respect, transparency, and trust, and this should be routinely considered. So it also was folded into a GBIE Ethical, Legal, and Social Implications Conference in 2022 with the idea that genomics has been thinking about report back and the ethics surrounding it for a really long time. And there are some really interesting lessons to be learned and common principles there, but there are also some key differences. So the merger of these two is also super exciting. And this caught the attention. Okay, so we were real pains about it, and when I followed Julie Brody from Silent Spring Institute on NAEHS Council, and pretty much every meeting would say something along the lines of, and report back is really important. How are we going to make sure that it happens? And Rick Wojcik essentially said he got sick of hearing that. He did say in my last council meeting, I don't want to come back next fall and hear Korfmacher complaining, what are we doing about report back anymore? So, I don't know, just persistence, maybe that's the life lessons here. And he interviewed Julie Brody and I for a director's corner. He said he did have us come back and present to council after I was off and essentially endorsed this idea without saying so, but by posting it in this corner, by accepting our presentation to council, and then his staff has been continuing to move this idea forward. The NIH Office of Directors really interested in report back in other fields, not just environmental health, and so they joined together with NIEHS to sort of participate and sponsor some presentations on national platforms that I've listed here, and they also funded research on report back, right? So how does an institute move something forward? They pay for more research on it. Now, I don't think more research is the solution here, but it is certainly a step and a sign that, yeah, this is the direction that we're moving in. So what's next? Hold that thought. Okay, so that's the context I wanted to share about the field of report back. and now taking a step back of how I started trying to learn about and contribute to it. So after that air quality participant story, and I mentioned we got this report, 21 pages, couldn't understand it, I got a pilot grant from our P30, a mini pilot with Hopke, who's emeritus professor. He is a terrible role model, Johnny. He is 82, he's been retired for 15 years, and he is very, very active in our center. Don't do that. So we worked together to try to make that report something that was accessible and understandable to the people who participated in it. After a year and at least 4 or 5 iterations, we got it down to 6 pages, and it was still too much for many of the communities that we work with. At that point, I could understand it, but it also taught us that there is a lot of resource involved in doing this. It took a lot of time. It did require iterative work with people who would be receiving the reports, the researchers who had to crunch their numbers in different ways. They couldn't just take their graphs and make them pretty and more user-friendly and put pictures on them. They had to reanalyze their data to answer the questions that individual participants had, as opposed to the analyses they were doing to answer their scientific research question. So that was really humbling and made me realize, oh boy, we have a lot left to learn on this. So we started trying to work with Silent Spring Institute to get a larger study funded where I could really, kneel at the feet of the experts and learn alongside them. Again, life lessons and persistence, and this is a little embarrassing, but because I trust you, I'm going to tell you, 5 tries for this R01. We submitted it twice. We changed it a little in context of partnering with home visitors to do a healthy home intervention and work with residents in very low-income housing around home hazards like lead and mold and radon and other things. It never got funded, and we finally, in frustration, broke it apart into the environmental side and the health side. The environmental side was immediately snapped up by HUD, the Housing and Urban Development, as a technical study, and then we turned around the next year and submitted it to NIEHS as an R21, and that too was funded. So I just want to give you that context of this study. Did not come from thin air. It took some persistence. But it goes back even farther than that, to my work with the Coalition to Prevent Lead Poisoning, expanding that work to a healthy home museum where we were bringing people into a model home to teach them about home hazards, a healthy home partnership that said there are many, many groups that go into homes for domestic violence, child development, all kinds of different reasons that don't know anything about the physical and environmental hazards in homes. And they're there in homes. They really should be trained to intervene or at least assess while they're there. So this idea of trying to promote healthy homes with home visitors goes back to 20, 25 years to our work with in lead poisoning and healthy homes. And it also draws on a study that we did in 2014 in partnership with the city, looking at lead on porches, which is a whole separate story I'd love to tell you, but the bottom line is we partnered with the city of Rochester in their HUD Home Rehab Grant program. Do you have something like that here, where people can get grants to improve their homes and the HUD pays for a lot of home renovation? Okay, well they do all over the country, particularly one big batch of it is for lead hazard control. So you have to meet income requirements. Landlords or owners can apply, but you have to have a child under 6 who might be at risk of lead poisoning to get $15,000 to fix your home. So we had partnered with the city program to do this, and they were doing the intervention, right? We were doing the research after to see the effect of that intervention. We weren't actually doing the intervention. And we did find that there was lots of lead on porches. Parents had previously told us their kids play on the porches because it's not safe to play in their neighborhoods in Rochester. So they were getting exposed to lead on their porches. And as a result of that study, HUD adopted a porch standard into their national regulations. Now, just for those of you who are interested in policy impact, this never happens. You do not have a federal regulation that cites your one paper as the one reason that policy changed. It does not happen. Please do not use that as a gold standard. It was just like dumb luck, but I'm still going to brag about it because it's possible, right? We should shoot for that. But it did affect policy in this really linear, identifiable way. And then turned around, finally, we got the city of Rochester to adopt that porch standard back again, which had started 20 years previously because of parents in Rochester. So this study has a long community genesis, but I wouldn't say it's community-based participatory research. Our partner was the city of Rochester, and we were building on that model of the Porches study but expanded it, where we had this partnership with the city. They trusted in us enough to let us do samples before that lead hazard control work, just after, and then another 3 months after that happened. We also were collaborating with the National Center for Healthy Housing again. I want to highlight for those of you, again, who have policy interests, because it wasn't saying I as the researcher, Silent Spring as the researcher, was going to go directly and make a policy impact. We were partnering with a national nonprofit whose goal is to change policy, right? And we brought them along as partners in our research so that when we were done, they would know exactly what our research means for policy and can carry the water to interacting with HUD that our government relations office would not want us to be doing. We also collaborated with a community partner around taking the samples and doing some of the home visits. And then, as I mentioned, this sub-study was funded by NIEHS that added urine testing to the dust sampling and also investigated the results of report back. So this is super complicated, right? Just to take a step back, the city is coming in to repair people's homes. One of our studies is looking at dust before and after that happens. We're also doing an intervention along the way, giving half of them vacuum cleaners and education, half of them not. So it's a RCT embedded in this observational thing. And then we're recruiting some of them to do urine samples to add a health component to it. You don't need to remember all that, except that the report back component is just that last thing. I am not telling you about all the other parts of the studies because this is backwards, right? Usually you take the scientific results, you publish them, We're starting with the report back. So this is that we are telling the participants now, and all the rest of the stuff is coming later. So I've highlighted in green text a little tiny part of this project that I'm sharing with you now. Okay, that's a lot. Is anybody thoroughly confused at this point and need to be sorted? You get the, sorry?
What's rock?
What's rock, right? Rochester Home. I'm really bad at acronyms, so usually I let my kids work on them. But recently AI, hate AI, but for generating cute acronyms, wonderful. Okay, so here's some of our study team, just to give you a visual of all the actors who are playing here. And I've sort of coalesced our objectives. That first we want to see, does this lead hazard control grant program, while you're cleaning up lead, also clean up other things? So is it reducing levels of pesticides, phthalates, flame retardants? Because if so, maybe we should do a lot more of this lead hazard control kind of remediation for all these other good child development reasons. On the other hand, it could increase them because we are putting new vinyl windows, new vinyl floors. We could be increasing some of these chemicals. The second is to ask what happens. So, my pet project of trying to engage residents through home visitors, when does that make a difference in helping them once they have a baseline solid level of housing? Can they sustain that level better if they have been engaged in learning about how to do that and why and how? The third is analyzing the relationship between what we see in dust and urine. Again, that's the part that's TBD. And then the fourth is when you do give those results back to people, how do they respond? What do they learn? And that's the part I wanted to highlight now. But since probably you're interested in the scientific side of it, I'm just going to tell you very quickly, and give myself like 3 minutes here. That the things we measured were lead, allergens, and SVOCs in the dust from these homes. Before, just after, so right after a nice cleaning and a big tune-up of the house, and then 4 months later, with the idea that it's re-equilibrated. People have gone along using products, living their lives, messing up their homes again. What happens then? And then this sub-study collected the urine samples to see if you can see any of those differences in urine. And then we finished, we're reported back the individual results, but we are doing visits now to talk with them about the process of learning about those results. And then we're going to share the results with the community, and then we're going to start publishing this stuff. So again, this is just an overview of how this worked for our 4 visits, and I'm highlighting visit 4 now, where we just go and do a healthy home assessment and talk to people about how receiving the results affected their feelings about their home hazards and health differently. I also just wanted to highlight what this intervention was. It's a little confusing because there was this $15,000 home rehab. That's not the intervention. The intervention is in half of those homes, we went in and gave them cleaning supplies and vacuum cleaners and talked to them about how controlling dust in their homes affects exposure and health. It also asked people about what kinds of products they use and the conditions that they observe in their own homes, educating about safer alternatives. As a research tool, it's really messy because you're doing education sort of iteratively along with data collection. But it's based on a survey that the state had been using, with 30,000 people over the past 15, 20 years. So we know it works pretty well. Oh, can I just tell one fun story on my Silent Spring partners? They're national, they're awesome, I love them to death, but they're based in Boston. So they'd never done research in Rochester before. They're excited about working with low-income homeowners. So we get the grant, we're excited to get started, and they're like, okay, so the messaging, make sure they're vacuuming once a week. I'm like, they don't have vacuum cleaners, and it was inconceivable to the people from Cambridge that someone could own a home but not be able to afford a vacuum cleaner. So we had to get a separate grant from a small local foundation to buy vacuum cleaners for everybody. Anyway, it worked out. But it's one of those, when you have new partners, you just don't know what you don't know. Okay, so I told you about this sub-study already, with the objectives of seeing how the SVOCs in household dust is, if you can see there's a relationship with them in urine, and then how do the results affect people. This is our study diagram, which when you pick it apart, everything's in there. I'm not gonna use this now unless we need to come back to it later, but it gives you a sense of the complexity of pulling this off, only with 86 people, but there was different stuff happening with everybody. But where we are right now is the very end, that we are in visit 4s now. Just very quickly, you all know why we care about lead. Hopefully you also know why we care about SVOCs, also because children. And if you're curious what SVOCs we are looking at, this is sort of a preview for those of you who might want to see what's coming out of Rock Home later. Lots and lots and lots of pesticides, phthalates, and flame retardants. Allergens, just mouse and cockroach because expensive. People told us they saw lots of both. And very preliminarily, yay, lead went down a lot, but it was still there. That's difficult to message to somebody who thinks they've just had a lead hazard control grant that makes their home lead safe. So lots of discussions of what does safe mean, what are health-based thresholds, and the need to be constant vigilance going forward. Interestingly, very little cockroach, at least above our level of detection. And in fact, people didn't report a lot of cockroach in these homes that we went to. We've heard more in rental homes in Rochester. Did find lots of things, this is one thing a participant flagged I thought was really cool about the results. She said, I did question some things because you're saying there's some stuff in there, meaning pesticides, that we never use. I was like, exactly. Once the stuff gets into your home, it's there for a really long time. And in fact, DDT, which was banned in 1972, was found in almost a third of these houses. That's pretty humbling when you think about things that we are still putting into the environment now. Other challenging thing is that we are not able to compare to national data on a lot of these things. This becomes important for the report back. Phthalates is one of the few things that we could, and we found generally similar levels to other places, but some of the newer phthalates, especially those associated with fragrances, were higher than some of the older studies that have been done in other places. Okay. Can talk more about that later, but again, trying to get to the report back here. So we worked over the last year and have been thinking about throughout this study, how are we going to share this with participants? So demographically, I think we all English speaking. Many of our participants their only income is Social Security, not a very high educational attainment, and really interested and concerned about their children's health. We have measurements in dust from 3 different time points of 3 different things, 3 different kinds of things, probably 50 different chemicals, and dust and urine. Try to communicate all that in any way that is meaningful when there aren't health-based standards. It's really hard to get our heads around. So we did work iteratively with piloting with people who are not our participants, but similarly situated to come up with the most user-friendly way of doing this in a way to communicate We did use that Derby system that I mentioned before. We pointed out to Silent Spring that a lot of the people that we worked with weren't real comfortable digitally, so we gave them a choice of paper or digital. The vast majority chose digital, but for those who chose paper, they've been really happy with their choice as well. And then we are going back to ask them, what was it like to get that report? Did you understand? What did you learn from it? This is really important to us because when we talk to these folks about why they joined our study in the first place, and your CTSI might be interested to know this, we gave them a list of reasons, like some of the things we've heard from people about why they participate in research. The first four, in fact, were like the helping to learn, contributing to research, improving society. We basically stole those from CTSI surveys, but adapted them to our particular study. But then we added finding out what chemicals are in my house's dust and, learning from that. Please remember that we were giving people vacuum cleaners that were worth about $200 and up to about $500 over the course of the study in incentives. And if your annual income is $18,000, that's not an insignificant amount of cash. And yet, 97% of them said that getting the results back was either important, very or extremely important. Only 2 people who were lower, it was still on the list. And almost half of them said it was the most important reason they agreed to join the study. Not the $500, not the vacuum cleaner, not contributing to the greater good. It was to find out what the dust levels were. To me, that's pretty powerful to know. And having done a lot of these home visits myself, I can say that's very sincere. People are very interested. The way we tried to share through these reports was to work very hard to personalize headlines when not just here's the data that's personalized as what we found from your house, but what are the key things that stuck out as you were way above everybody else, way below everybody else, about the same, because that's really all we could do is compare to other people in the study. That's something we can talk about more because it's super complicated and controversial. Most people say they don't care what other people's results are, but the point is, if you are higher than everybody else, there is something you could probably do, either that is, exogenously affecting you or that you're doing in your house that could be done differently, and we are giving you the tools to figure out what that might be. So, I think we could have a very interesting conversation about it, but that's the philosophy we've been working on. With these bubble plots to show, with respect to everybody else's results, where are you for each of these 3 time points for each of these chemicals. Also some graphics that we thought were really helpful to help people understand why we were giving them urine results as well, that we were curious what from their household dust might be getting into them, but to remember that also these chemicals could be getting into them from the things they eat, from what they drink, from the products that they use. So we had 2 different reports, some for those who only had dust and different ones for those who had dust and urine. So the novelties here are with respect to the kinds of report back work that has been done before by Silent Spring and others, that there's a mix between the kinds of things we were studying and those that have health-based standards and not, that there's this relationship between dust and urine and multiple media over multiple time points. So again, this is what we are doing right now. We're asking people about the report back. What did they learn? Did it make them worry? What were their questions? We're doing a final HNP assessment, and we're also training a community partner to see in future studies, is it viable to have a community partner do this work? I think you probably all know the answer to this. And that it is really complicated, so it does take a lot of training. Next up, after we finish these visit 4s, we'll be informing the larger community about what we found. We've also been working very closely with the city throughout this time to give feedback on their program implementation. For example, we already pointed out, you spend $15,000 on these homes. We come in 4 months later and ask people about their furnace filters, and they say, what? Like, you didn't spend $20 to get them a new furnace filter and show them where it is, and that's like a really well-established way to improve home health. They started buying furnace filters for everybody. So just that partnership, that's a policy change, right? This is, they are doing that differently, and they're going to bring that back to the HUD national meeting, and I would not be surprised if that doesn't diffuse out through other cities that have these grants. We'll also be then directly sharing these lessons back to HUD about, like, again, $15,000, why not throw in a vacuum cleaner? Everything from that to, $15,000, how about $200 to get an actual human being to go and sit with the people who live in the house that you've just fixed up about what you've done and what it means for what they need to do going forward to keep their home healthy, and then disseminate those results to broader audiences. If you would like to follow along with the study and the parts of, that is coming out of it scientifically, we do have a website now. You can play around on that sample report. So that's an actual report. You can go in and see what it's like for a participant. Pause. Okay. So I am gaining appreciation for the complexities of this, and also understanding that this is a very proven practice, that people want their results. We can deliver them to them. We can do it in ways that they can understand. But why isn't everybody doing it? There are still a lot of barriers. And the work that Julie Brody and I did, as we timed out from council, said we really need to clarify what are our expectations and guidelines. If you're applying for grants that do this kind of work, you get a general sense you should do something, but it's not clear how or why or with what. We need training and capacity building to help people do this kind of work well, and it costs a lot of time and money. So we need resources for that to happen. And then ways of disseminating the things that we are going to continue to learn in this field going forward. So Julie Brody and I wrote this commentary in Environmental Health Perspectives about 2 years ago now to sort of summarize all that and basically pull together the argument to NIEHS that the ball was in their court and they needed to move this forward now. And they have. So they took that and funded a series of 8 R01s that were funded last June to do research on different parts of this practice of report back. How can we do it well? How can we socialize it to large, to all research as appropriate that's doing this kind of work? We have some ideas about how that could be expanded, including developing a report back manual. Like, if you're not familiar with this Partnerships for Environmental Public Health Metrics Manual, reminds me of when Johnny and I were doing this work 25 years ago. We were trying to evaluate, were we making an impact, right? But not everybody was doing that, and it's really hard, and we were all making the same mistakes and learning. NIEHS invested time in developing this metrics manual, which pulled together a lot of those lessons and learning and is, in fact, a guide that is referenced in RFAs and is now standard practice throughout our field. Maybe something like this for report back would be helpful. I'd be curious what you think about that, because I say that to Rick Wojcik every single time I see him. Imagine, if you will, if RFAs said something like this. I'm not proposing they said that because you're not allowed to have impact on what an RFA says, right? Because then you can't apply for it. But imagine, how would you react if your RFA said something like that? Just to highlight, and again, full disclosure, I did get one of those R01s. It had a really silly acronym before, but now AI has helped us name it SHELTER, Shared Housing Exposure Lessons, Transparent and Ethical Reporting. My co-PI is a philosopher. It is so much fun. We are talking about what are different scenarios for housing-based environmental health research that might have different ethical implications for how and to whom and what kinds of report back you do. Housing's really tricky, right? Like, lots of people live in your house. If you're the one participant, do you talk to everybody? What if it affects your property value? What if it affects your neighbors? So there's a lot of really interesting questions that we're going to be asking here of experts in the field, and then trying to create guidelines just for housing exposure to research to see if we can help move this field forward. So this is thanks to the Rock Home team and to everybody who's been helping to develop this field. So again, I've given you like this introduction to a field with a little learning example, and then where I'm hoping it will move with the help of people like you. And I am ready to hear what your questions are. Yes, please.
Brennan.
Okay. Really interesting. The question that came to mind is, so we don't do studies with humans in our lab, but we do study oftentimes like a really specific area that impacts a specific population.
Yeah.
And so they didn't necessarily sign up to be studied.
Yeah.
Like studying mine dust or studying a certain kind of smoke from that area. So what are your thoughts on reporting back when it's a little bit more vague?
Yeah, I'm so interested in that one because this is part of why I explained to you that I was trained in ecosystem management, which was much more like that, right? You're studying the physical environment that people happen to live in and how do you report back there. And there really is very little development of an ethical field there at all. We in the biomedical sciences are coming from a clinical model. The work you describe and what I'm talking about is where these two are going crunch, crunch together, which is a long way of saying, I have no idea. But one of the studies in this cohort is looking at wastewater surveillance, which is like my COVID passion is monitoring poop. So I'm so excited about that one because they're like literally, communities did not sign up to have their poop studied. And all these interesting things learned about them, at what level of geographic scale, scope, and interpretation is it appropriate to report that? How do you speak for a community when there may be many communities that are all contributing to the same sewage system similarly? So I would love to, I think this is going to be a continuing dialogue, and I hope that, to have that. So, okay, then the person in the back, please.
How do you decide at what learning level you disclose this information at? And is it one learning level is good for an entire community? Or? Yeah,
that's a great question. So the Pollution is Personal handbook says the very common sense answer is most of this work was done with a community partner. They work with a community partner to identify what is the learning level, what is the environmental health literacy, what are the questions of that community, and then when you start the reporting to aim for that level. If you don't have a community partner, it's harder. So we are partnering with the City of Rochester, but accessing other people or part of their programs to help give us that feedback.
What level are you at?
Oh, that one, I think it's at eighth grade, yeah. Which is, yes.
My second question.
Can I say one other thing though?
Yeah.
And in the shelter, the one thing everybody's agrees with so far is that they always mess it up out of the door, that it is iterative. And I think this is a problem for like trying to standardize it in your protocols or in your grant, is that you cannot know how to answer that question until you start doing it, I think. Yeah.
So my second question
Okay.
goes back to this. You said figuring out what was learned is really important for your study. How are you assessing that, and how does that affect how you go back and then change what your learning level and what your education strategy is?
Oh my gosh, this is right where we are right now. It's making my head explode. After our P30 goes in, I'm going to take a long walk on the beach and try to figure that out. It's a super question because we hypothesized that we told people about things we might find in their household dust, taught them what to do about them, regardless of whether they were there or not. Then we told them what was actually in their household dust. We're really curious is having that quantitative information going to change your behavior differently than sort of generally this is good practice? Because that we did find that with lead. When you're above or below a standard, that got people acting. There is no such standard for most of the things that we're talking about. And so far, everybody we've talked to has said, you've been in our homes, we trust you, we like you. If there was a problem for our health, you would have told us. So no, none of this worries me. So yeah, we have to really go back to the drawing board on like what we thought they were going to learn, and they kind of trust us too much. Yeah, thank you.
Thank you for that talk. That was very wonderful. So I guess my question kind of goes along with that. When you go to these communities and you're going to research this, is a lot of it known by the community, or is it like half and half? They don't realize that this is a problem, or maybe as serious of a problem? Like when you're first conducting the research, do a lot of them know that this is a problem, or do they think something else is possibly a problem?
Oh, super question. Yeah, this particular study is a really weird one, which is part of why I thought it would be interesting to sort of have a different kind of scenario in the report back milieu, because again, many of the studies that the field of report back has been generated around is there was a community concern, a study was done, people wanted the results, both the individual and the community level, so that they could find out about that problem that they were originally concerned about. In our case, there are those general concerns that I mentioned that sort of gave birth to this study, but people signed up to get their homes repaired. And then we asked them, hey, do you mind if we learn something about these issues, like lead, which is why you're in this program, but some other things too that might help your children's health? And they're like, yeah, that sounds like a good idea. But that's really different than coming to a study saying, my kid has asthma, I want to know why. And that, I think, is part of why this report back scenario we're going to learn a lot from, because it is pretty different.
And I had another one.
Yeah,
Do
thanks.
people get defensive when they hear the results back? Do they take it like personally? Like, I guess it depends on how you explain it to them, but do some people get defensive of, oh, you're saying it's all my fault because I have this house, I'm making my kids sick, I can't afford to do something else, or do people get very defensive of it?
I've gotten zero of that so far. A few people are concerned because they know that the city was in their house and they made it safer. And they're like, wait, but you're telling us there's still problems. How can we blame the city for it? Or how can, what outside source could be driving this that we can fix? And a lot of times the answers are many of these chemicals that we're looking at are in fragrances, and you have control over that. Instead of spending $6 on this cleaner, we've given you baking soda and vinegar and water that, by the way, you can buy with your SNAP benefits. So we're offering you a low-cost solution, explain to you that we don't know if this is a problem for your child's health. All we know is that more of this stuff is probably worse, and if you want to make your home as healthy as possible, here's some solutions you can try. And people are really interested in doing that. They get the idea that there isn't just a black and white, safe, not safe. They understand the idea of risks and trade-offs, and that even though I'm not going to stop using scented dryer sheets because my husband really likes the way his laundry smells, it's nice to know. I'm glad I have that choice to maybe do this other thing, but I'm not getting rid of the scented dryer sheets. Thank you for your questions. Yep, and I'm going to just work my way that way if we have time for two more. Thank you.
You just commented on this, like giving sort of a recommendation along with like this is probably bad for you based off of what we know. So I do sleep-related circadian stuff, but we struggle with doing these report backs. Like we've done big group kind of settings with our participants in terms of at what level do we give recommendations when like science is catching up to tell us this is probably good for you, but where do we stand as scientists to say something without maybe overstepping kind of the boundaries of what we actually scientifically know?
Yeah, that is super hard. And I think that's where the working with community partners who really can understand what is the nature of scientific knowledge. Oh my goodness, is Lacio here? Okay, right. A certain reviewer from a certain journal recently said to me, this sentence that you said is the likelihood that we will be dealing with uncertain knowledge for years to come. How can knowledge be uncertain? Only a scientist of a certain sort would ask that question. Community members have no problem with that. People understand that in your daily life, you're making decisions, Surely God loves a P.11 as well as a .05, right? To anyone outside this room, that is totally obvious, but only within it does it. So that's not a direct answer other than to say it's not your job to decide what is appropriate or not, but working with people to help understand the nature of uncertainty and, that you don't know either. I know that's really not a satisfying answer. I know, it's just not.
Yeah, my question was about uncertainty as well.
Oh, yeah.
You're reporting, that your levels are higher than most people.
Yep.
And people want to know, well, what does that mean?
Yeah.
We have to say we don't know.
Yep.
And that's a difficult thing to
Yes.
communicate, and so that was just my
Yeah, it absolutely is.
already addressed it a little bit.
Right, and this is where someday if I have more time, I really want to dive into my deep history with conservation biologists who understood in the 70s and the 80s that the creatures that they were studying were being threatened by things that were going on, but there was a lot of uncertainty and action needed to be taken before they got to the P.05, right? And they got more comfortable of engaging under circumstances of uncertainty. Coming from a clinical realm, I think that is really hard for our field, and that's where I'm trying to, with this philosopher, literally try to merge together those approaches to understanding the nature of uncertainty and communicating it to others.
Yeah,
Whoa.
you want to be able to draw straight lines, and the lines aren't straight necessarily, and so that's very easy.
Yeah, most of my slides have like a big octopus graphic at the beginning or end. So that's sort of a big picture, good one to end on. But I see my host here has one, so host prerogative.
Yeah, I just want to mention that the scientific uncertainty is a very important topic. And I think there is this expectation that the public would want things to be uncertain. But at least from patient-provider communication literature, we know that doctors that do communicate uncertainty get sued a lot less. So what doctor said, I don't know, or even later I made a mistake, except for a surgeon.
Yeah, I was like,
So they're actually not going to be, so people do understand uncertainty.
yeah.
It depends on how it's presented, but.
Oh, I think that's also really nice full circle linking back to the widespread interest in microplastics in this room. Like, whew, uncertainty are us, right? Like, this is a really squishy field, and people keep asking me, well, what can you learn from lead for microplastics? Like, not a heck of a lot, because that's like 1.1 time, one metal, boom. Lead poisoning is caused by lead. This is something totally different, and sort of extrapolating these approaches to uncertainty is going to be so interesting and important. So thank you so much for your interest and attention.